بسم الله الرحمن الرحيم. محاضرتنا اليوم كانت موضوع يتعلق بالإميونيتي وكلش مهم بالنسبة لوضعنا الحالي وألرجي. What mean allergy and how we manage the patient have allergic problem. Definition of allergy. شنو نعرف الألرجي؟ Allergy is a reaction of immune system to something that does not bother most other people. So, it is an immune reaction of the body against certain substance that enter to the body for certain people. People who have allergies often are sensitive to more than one thing. حقيقة allergy not for one thing only. It's more than one thing that lead to an allergic reaction. So, it is very complicated subject. حقيقة, the genes and environment have something to do with it. Normally, immune system fight germ is body's defense system. In most allergic reaction, however, is responding to a false alarm. حقيقة, there are false and there are positive allergic reaction. And something is give have an allergic as a false reaction. The allergic reactions are sensitive to substances called allergen that come into contact with skin, nose, eyes, respiratory tract, and gastrointestinal tract. They can be breathed into lung, swallowed, or injected within the skin or mucosa. That's its material that lead to have allergic reaction. The allergic reactions are common in the population. The immune response that causes an allergic reaction is similar to the response that causes fever. Then, when have inflammation that lead to reaction in the body and lead to fever is similar to allergic reaction. Most reaction happen soon after contact with an allergy. So, if there are substances of allergy that in contact with the skin, the mucosa of the body, or injected or respiratory inhaled or ingestion that enter to the gastrointestinal tract. The classification of allergic reaction, allergy, depend on its severity, that for mild case and severe and may lead to life-threatening. And according to its area that contact the body as a small area of the body or affect the entire body. The most severe form is called anaphylaxis or anaphylactic shock, that it is very dangerous, may lead to death of a person by this severe allergic reaction. The allergic reaction occur more often in people who have family history of allergy. The family history is very important when taking an allergic reaction to the person. This figure shows the most important allergens that affect any human being, like pollen, dust mites, mold spores, bed dander, food, insect sting, such as bee sting, or medicine as drugs that lead to an allergic reaction. This figure shows the allergic reaction that through the skin contact or injection or ingestion or inhalation, like skin contact, any poison plants, animal scratches, pollen, lattice. This lead to have allergic reaction of the skin. If there are injection of the drug or bee sting, that lead have an allergic area of the injected area. The ingestion when taking any medication or some food like nuts and shellfish lead to have allergic reaction. Inhalation when any inhaled pollen, dust, mold, and mildew or animal danders that lead to allergic reaction. This figure shows the common allergic allergen that include animal dander, bee sting or sting from other insect, food, especially nuts, fish, and shellfish, inject bites, medications as drugs, and there are some fats or pollens that lead to allergic reaction. Also, first-time exposure may only produce a mild reaction. Repeated exposure may lead to more serious reaction. When a person has had exposure or an allergic reaction is synthesized, even a very limited exposure to a very small amount of allergen can trigger a severe reaction. The most severe allergic reaction occur within seconds or minutes after exposure to the allergen. However, some reaction can occur after several hours, particularly if the allergen causes a reaction after it has been eaten. In very rare cases, the action develops after 24 hours. So we have an early allergic reaction or delayed allergic reaction. Early allergic reaction after contact immediately after the allergen in contact with the body, but delayed reaction are a period, not more, less than 24 hours, and the sign and symptom of allergic reaction occur. Now, the anaphylaxis. What mean anaphylaxis is a sudden and severe allergic reaction that occurs within the minute of exposure. Immediate medical attention is needed for this condition. So, the anaphylaxis and anaphylactic shock is immediately reaction to any contact of allergen to the body. Without treatment of anaphylaxis can get worse very quickly and lead to death within 15 minutes. So you must give an emergency treatment in anaphylaxis shock or lead to death. Now we start with the common symptom of mild allergic action. This includes hives, especially over the neck and face, itching, nasal congestion, rash, and watery red eyes. This figure shows the rashes that have one of the signs of the allergic reaction to the skin or have a large area that calls hive. The moderate or severe reaction is symptom is abdominal pain, abnormal high pitch breathing sound, anxiety, chest discomfort or tightness, cough, diarrhea, difficulty in breathing, difficulty in swallowing, dizziness or lightheadedness, flushing or redness of the face, nausea or vomiting, palpitation, wheezing, swelling of the face, eye or tongue, and finally, unconsciousness of the patient that lead to allergic reaction. How manage the patient? The treatment of allergic reaction for mild to moderate reaction calm and reassures the person having the reaction as anxiety can make symptoms worse. Try to identify the allergen and have person avoid further contact with it. If allergic reaction is formed at bee sitting, scrub the stigma of the skin with something firm such as fingernail or plastic rigid card. Don't use tweezers. Using the stinger will release more venom. If the person develops an itching rash, apply cold compressions and over the contour hydrocortisone cream. Wash the person for sign of increasing distress. Get medical help for a mild reaction. A healthcare provider may recommend it over the contour medication such as antihistamine drugs. For a severe allergic reaction in anaphylactic shock, check the person's airway, breathing, and circulation that have ABC of basic life supporting. This three letters, the A, airway, B, breathing, and C, circulation, is very important for life support of any person. A warning sign of dangerous throat swelling is a very hoarse or whispered voice or hoarse sound when the person is breathing in air. The treatment of this severe or moderate allergy is calm and reassures the person. If the allergic reaction is from a bee setting, scrub the finger of the skin with something firm, such as fingernail or plastic credit card. Do not use tweezer. Squeezing the finger will release more venom. If the person has emergency allergy medication on hand, help the person take or inject medication. Avoid oral medication if the person is have difficulty in breathing. Take steps to prevent shock. Have the person lie flat. Rise the person feet about 20 inch and cover him or her with a coat or a blanket. Don't place the person in this position if a head, neck, back, or leg injury is suspected or if it causes discomfort. Call for immediate medical emergency for assisting. حقيقة اتصال بالemergency medical emergency في هالحالات is very important. The person is having severe allergic reaction. Do not wait to see if the reaction is getting worse. The person has a history of severe allergic reaction. في هالحالتين يجب الاتصال بالemergency. How prevent the occurrence of allergy? Avoid triggers such as foods, medication that have caused an allergic reaction in the past. Ask detailed questions about ingredients when you are eating away from home. Careful examine ingredient labs. If you have a child who is allergic to certain food, introduce one new food at a time in small amounts so you can recognize an allergic reaction. People who know that they have had serious allergic reactions should wear medical diseases. If you have a history of serious allergic reaction, carry emergency medication such as chewable form of chlorotrimazole and injectable epinephrine or AP setting kit. According to your healthcare provider instructions, don't use your injectable epinephrine on any way else. They have conditions such as heart problems that could be negatively affected by this drug. Another topic of allergy, drug allergies directory. Some drugs trigger allergic reaction in certain people. This happens when the body believes the drug is foreign substance that is dangerous. The body tries to attack the drug with histamine and other substances in order to expel it from the body. Some of these allergic reactions can be life-threatening, while others may cause itching skin, IV, congestion, or other less serious symptoms. And penicillin is a very common drug for allergy. Treating drug allergy must consist of symptom relief, but for serious reaction, epinephrine may be given. We have most important disease that lead to allergy is angioedema. You can see in this figure the most important sign of the patient have angioedema. The HIV and angioedema form when the response to histamine blood plasma leak out of small blood vessels in the skin. Histamine is a chemical release from specialized cells along the skin blood vessels. The allergic reaction, either chemical in food, insect setting, sunlight exposure, or medication, can all cause histamine release. Sometimes it's impossible to find out exactly why HIV have formed. We ask some question about the allergy that what really causes your urethral hives and angioedema. We are taught to believe that urticaria and angioedema is caused or triggered by a specific source of allergy, such as perfume, dust mitts, hairspray, knots, and solving tight clothing, pressure, chase your dog, etc. This all as an allergy. We have acute urticaria or acute angioedema, and there are chronic urticaria or chronic angioedema. The first one, acute urticaria or angioedema. The sinus symptom is heavy or swelling lasting less than 6 weeks. Most common causes are food, medicines, lats, or infection, insect bite, and internal disease may lead to responsible. The most common food that cause HIV are nuts, chocolate, fish, tomatoes, eggs, fresh berries, soy, wheat, and milk. Fresh food cause HIV more often than cooked food. Certain food, additive, and preservative may also be to be pill. Medicines that can cause HIV and angioedema include aspirin and other non-steroidal anti-inflammatory drugs such as ibuprofen, high blood pressure medication as anticholinergic inhibitors, or painkillers such as codeine. Other topics is chronic urticaria. We have acute urticaria and now chronic urticaria or angioedema. HIV or swelling lasting more than 6 weeks. The cause of this type of HIVs is usually more difficult to identify than those causing acute urticaria or acute angioedema. The causes can be similar to those of acute urticaria, but can also include autoimmunity, chronic infection, hormonal disorder, and malignancy. Other topic is physical urticaria. HIV caused by direct physical stimulation of the skin, for example, cold, heat, sun exposure, vibration, pressure, sweating, and exercise. This leads to a physical urticaria. The HIVs usually occur right where the skin has stimulated and rarely appear anywhere else. Most of the HIV appear within the 1 hour after exposure. We have two terms. First term is termatographism, that means IVs that form after firmly stroking or scratching the skin. These HIV can also occur along with the other form of urticaria. Second term is hereditary angioedema. This is painful swelling of tissue. It is based on the families. In angioedema, redness that normally accompanies urticaria isn't seen, but the swelling are thicker and more obvious. This swelling generally occurs on the head, neck, face, finger, and toes. Attacks of angioedema may be quite disfiguring. The swelling can cause the lip to look like sausage, and the eyelids may be completely closed. For the vast majority of the surface of angioedema is unusedness rather than a life-threatening condition. This figure shows the enlargement of the upper and lower lip as a sausage, so-called a sausage sign of the lips. However, in some cases, the mucous membrane of the mouth and throat and both sides of the tongue can be affected, sometimes considerably, that occur to allergic reaction. When angioedema affects the throat, the condition is called laryngeal edema. Varying degree of laryngeal edema may accompany angioedema in about one case in 5, but in other cases, laryngeal edema may occur alone. In most cases, throat swelling is mild, not significant swelling of the tongue or throat, enough to affect the voice of causes and degree of distress. Should be regarded as emergency and urgent medical assistance should be obtained. If this has happened previously, an adrenaline injection or emergency use, like EpiPen, may have been provided. If so, this time to use it. This figure shows other problem in angioedema. When angioedema occurs in boy and in men, the scrotum and penis may be involved. Angioedema is not usually itchy, but is often described accompanied by mild pain or uh, by burning sensation. Angioedema, like urticaria, result when a specialized white cell mast cell release chemically messenger such as histamine. In angioedema, the histamine is less superficial than in urticaria, and this result in the characteristic tissue swelling of the condition. Both conditions may result from allergy. Sometimes the cause is obvious. For example, a warm setting should cause it in someone with a worse renal allergy. Sometimes it can take detailed investigation to find causes, and in many cases, over half, such as on cases, is found even after detailed investigation. The later condition is called idiopathic angioedema. Now, how treat or how the general management of allergy. We start the diagnosis by allergy tests, such as skin tests, should made to determine the causes. The standard treatment is with antihistamine for severe cases. Corticosteroid, such as prednisolone, may be included. How we manage patients have allergic problem. The dental aspect for patient complaint of angioneurotic edema is possibly a great risk of sensitization or of acute reaction to drug use in dentists. Problem may cause a drug, particularly corticosteroids, but drug must and drowsiness affect patient taking antihistamine. Dental materials such as mercury, which accidentally come in contact with the patient's skin, can very occasionally come into contact with dermatitis, but do not affect the oral mucosa. And very small uh, uh, the dental materials such as mercury, which accidentally come into contact with the patient's skin, can very consequentially some come into contact with dermatitis, but do not affect the oral mucosa. In a very few patients with abscess stomatitis, aspiration appear to be precipitated by certain food, especially when not chocolate or fruits. Thank you for your listening this lecture.